Welcome to the Continuing Education module, Conducting Wellness Program Design Process in Large Organizations, Strategies for Complex Entities. Our agenda for this module includes what employers need from a wellness program design process, how to position wellness, overview of a planning and development process, participants in the process, planning process guidelines, consultant findings, planning do's and don'ts, questions in the planning process, and summary of key points. Employers need related to a wellness program design, wellness programs that are administratively simple, delivered at a low unit cost, are non-invasive to the work process, have easy to make measurements of activities and results, produce documented high cost savings, and produce high levels of employee satisfaction and value. So when you think about what an organization needs in terms of a wellness program, I believe that these characteristics help us understand where the employers are coming from when they think about a wellness program design project. The strategic positioning of worksite wellness programs can either be oriented toward the economic benefits that such programs derive or other benefits. We tend to think of the economic benefits as return on investment. So our ability to deal with each of these different items underneath on the left-hand side of this slide includes the decreased overall health benefit cost, and that can be either an absolute cost reduction, or it can be a reduction in the expected medical trend for those overall health benefit costs. We can look at reduced or decreased healthcare utilization parameters, things like days of hospitalization or numbers of physician visits or prescription drug usage or whatever other kind of metric that we want to use. It also can be reduced sick leave absenteeism, either in the form of dedicated sick leave reduction or sick leave reduction that takes place through a proxy measure like unscheduled leave rates. Another one of the areas of economic benefits for positioning is fewer on-the-job accidents and lower workers' comp costs. We can also have reduced disability claims, and that can be oriented toward short-term and long-term disability, and reduced premature retirement, so that individuals who are essentially leaving the workforce early in taking with them their skills, expertise, and knowledge of the company. So these are all different forms of economic benefits. We also look at that generally as return on investment when we look at savings produced from any of these articles or any of these individual items compared with the actual cost of the program. The other benefits, VOI, the value on investment, which is the current terminology around this, deals with increased worker morale. It can deal with the increased productivity by whatever measures we're using to quantitatively look at productivity change over time. It can also look at creating an informed healthcare cost-conscious workforce, something we don't generally have in the U.S., which is a cost consciousness around our use of healthcare services. Producing a positive public relations effect, contributing to the citizen effects that our organization wants to have in its locale or in its markets, as a recruitment and retention tool, and also as a trade-off for other benefit changes that come along. So there are lots of different ways in which we can be looking at other benefits that our wellness programs can achieve and can produce, and that then deals with how we position strategically the wellness program as we're working on a design approach for a particular organization. Now, the overview of the planning process that can be used includes the composition of a planning or design team, program design team, the completed data collection process, so we may collect specific types of information to help us plan out the design. We analyze that data. We generally can hold a 2-day planning retreat where we spend a half day. This is some of the things that I was doing in my consulting career, probably somewhere around probably a 50 to 70 of these large facilitated planning projects. The retreats would generally be planning retreats, and the first half day would be focused on learning about what's being done in wellness, where are the challenges, how are those being addressed in the marketplace, what are people experiencing in terms of evaluation of programming, all that kind of information. And then the next day and a half would be spent in a facilitated design process that we'll be looking at in more depth in later slides. But that initial 2-day planning retreat really kind of set the bar and set the metrics for what we would be doing in this overall process. It's usually facilitated by a consultant, and most of the time it's an external consultant that is helping a design team, an internal design team, to design a wellness program. The development of findings is oftentimes involved, particularly if there's been a wellness program in place, but it's not really reached the level of results and the level of effect that the senior management wants. So those findings are oftentimes appropriate and necessary to be able to move on to a new approach in wellness. Then identifying needs and goals for the new program, used a team consensus to develop those details, and we'll talk about using what's called a modified Delbecq approach to coming up with a design with priorities for that design. Review the draft of the proposal and finalize the details of a proposal. So that proposal gets developed after that 2-day planning retreat. Usually takes somewhere in the area of 3 to maybe 8 weeks to get it back to the client and then have a finalization process take place. We'll cover that in more depth. Present the proposal to the executive management team. So that's another part of the process. That's usually, by the way, includes turning the proposal into a set of PowerPoints so that they can be presented effectively to different groups and particularly the executive management team. And then getting directions for the next steps, which hopefully includes approval to move forward with the funding and with the program as laid out in the proposal. So this is the overview of the planning process. Again, I've used it more than probably 50 times, between 50 and 100 times over the years. It's actually for mostly large, complex organizations, and it helps them actually either upgrade their existing wellness effort significantly or starting a new wellness effort for their population. Now, the planning process can be laid out in this form. So what we just went through can actually be turned into this graphic, which starts with obtaining a mandate for a wellness initiative. So that initiative may be a redesign of an existing program or the formation and establishment of a new wellness program. Composing the wellness design team. That process, if you've not had much experience with wellness, usually has a research and discovery phase. And that's where you're assessing what other people are doing, what is likely to occur, what's the evidence for these programs. You're looking at issues that have to do with how this might proceed. And then you're moving into, particularly in the 2-day retreat format, looking at identifying needs, formulating goals, selecting interventions to go along with those needs and those goals, determining your anticipated effect and outcome measures. Then after that 2-day period, going ahead and putting a proposal together. And we're going to look at an outline for what that proposal might contain. And then obtaining approval from an executive management team, implementing the program during the year, and then usually coming back at the end of 12 months and performing an evaluation of the activity. And that's what we call the wellness program development cycle. Now, the way in which I found worked very well to do each of these is when you have done the half day of orientation for an education for the group, then moving into a process where you essentially say as the consultant, um, let's have you suggest what needs, wellness needs should be addressed in our population. And the ground rules are you can say anything you want, we'll put it down in a list, and we'll take then all the items that people come up with and then essentially give people six big red sticky dots, and that's how you vote on maybe whichever of those needs you feel is really should be addressed by the overall program. So in doing this, 70 times or so, what I would generally find is we would come up with about 25 to 35, sometimes as high as 40 different needs. And then the group, we would essentially put this on a flip chart or using electronic versions of this, and then have people vote on those particular items. So if they had 6 votes, they could pick out of maybe 40 different needs the 6 that they feel should be addressed by the program. And then adding up all the votes then essentially allows you to prioritize the group's perception of what the needs are. The same approach is used again when you formulate the goals. So you have all the needs. It's nice to have them on flip charts because people can look at them around the sides of the room that's used for this planning kind of process, almost a planning retreat. And then that formulating goals, the same process takes place. You then ask people to come up with possible goals, and you kind of push them to articulate the goals in ways that you don't have to do a lot of editing. And then those goals get stated, they get put on flip charts. They then are the next set of items that you put around the walls. And then again, having people then have a number of votes. You select the number of votes that you want to use based on the size of the group. The more people, the fewer the votes. The fewer the people, the more the votes. So it allows you to then differentiate and prioritize on goals and needs. You do the same process about interventions. So people suggest HRAs, and they suggest coaching, and they suggest maybe a smartphone app that can be adapted, or an incentive approach. So those interventions again become the same kind of thing you're doing, and you're kind of steering the group back as a facilitator to say, now look at the needs, look at the high priority needs, look at the goals that you come up with and the high priority goals to address those. Now, what are the interventions you're going to need to, in fact, accomplish those goals? And then in that process, you're usually then also talking about what is this likely to do? What is the likelihood of it producing various kinds of results or outcome measures? And then that's going into a proposal preparation process after the 2-day retreat. So at the end of the 2 days, I would generally have maybe 25 sheets of flip chart paper that I would then take back, and I and my staff would then put together proposals. And we would essentially use a template, and then we would adjust the template according to what the group had come up with in its specific feedback. So that when we brought the draft proposal back to the group for another all-day meeting to go over that draft proposal and convert it into a final proposal for management, then everyone could essentially see the data and their input from the previous process. And what we found was that contributed greatly to their ownership over the program and also their willingness to help it succeed. And then the next step is usually turning that proposal, once it's finalized, into a set of PowerPoints. And the PowerPoints are then what are used to provide to senior management or executive management team a briefing on the proposal. And they would also get a copy of the full proposal, which oftentimes was anywhere from 60 to 120 pages in length. And depending on how much detail they wanted, they could look at it in deeper. But we would also give them a set of PowerPoints that would really summarize the main points of the proposal. And then from that process, almost every time we did this, they would in fact approve the spending of a large amount of money on a wellness program for the 3-year period that these usually covered. and then they would go into, after approval, implementation. And then the implementation would lead back into evaluation and then back into some modifications that might change some of the needs that are addressed. And those needs are targets and issues that need to be addressed. The goals may end up, changing a little bit over time, selecting interventions, and then being able to look at its effects. So the iteration around the bottom area is what happens after you've started the program. But you start the program at the top of the diagram when you're starting a new program. Now, the planning task force members, these are the types of people that would be involved in these types of facilitated large program design projects. And so in a usual employer organization, the larger the employer organization, the more likely it was to have people that would have a designated title where they were dedicated to a specific area. So all of those types of people were oftentimes involved in the planning process. When you look at the right-hand side in a health system organization, I worked on probably about 70 or so health system organizations over the years, and probably 20 of those were this full design process. And these are the kinds of people that would oftentimes be involved in the healthcare settings, hospitals, tertiary care facilities, multi-hospital chains, and health plan related situations. So these are some of the examples of the planning task force members. Now let's look at the planning process guidelines, and this particular graphic here is from actually an environmental planning activity. So it's just designed to be an example of another visual framework for a planning process, but it's not necessarily content-wise specific to the wellness area. In terms of planning process guidelines, I found in doing this process a number of times that it's best to include somewhere around 10 to 18 people. That's the size of the planning or design team. Include people generally supportive of prevention concepts and people programs. So if they were generally supportive of that, they wanted to take part in it, their job responsibilities were also related to that previous slide, those are the people that you want to basically have involved. You also want to include people who have some key responsibility or some perspective or influence. So they also have to be some of the movers and shakers, some of the players who are likely to have more influence in the organization. You also can include people who can contribute to it in a positive and supportive way to problem solving. So you want to kind of, in a sense, keep away from people who are going to continue to throw dust in the air, challenge things, slow things down, constantly, propose things that are going to cause people to slow down the planning process. So that's oftentimes a judgment call on the people who are doing that. If you do find, I've been in situations where there are people who have been acting like that, I usually take them aside and talk to them. And if they're willing to change their orientation, then they can stay. If they're not willing to change their orientation, I have to get internal approval to remove them. So that's happened in a couple different cases. So sometimes there are people there whose objective is to slow the process or actually derail it. So you have to be somewhat careful about the inclusion of people that are going to be helpful and supportive to this kind of process. You also want to include people who are likely to be important to the approval of the proposal. So you don't want obviously all the decision makers that are senior decision makers on this process. You may want to have one or two of them, but you also want there to be people on the design team who are known, either associates or confidants or people who are influential in that executive team. Also, you need to plan on making a transition into a long-term advisory group with some people dropping out of this design team and other people being added later, so that the design team actually can be transitioned into a long-term advisory group. So that's a definite thing to consider as you're doing this kind of facilitated design process. And you can plan on and should plan on at least a 2 to 6 month process. So when you're talking about a large organization and a lot at stake and a large budget amount, you really need to think through this process and think about it being 2 to 6 months in duration. Now, the findings of a consultant, and then these are actually findings that I shared with a client, one of the last clients that I ended up dealing with, which was a 24 hospital system. We were designing a wellness program that would serve all of their, at that time, 32,000 employees. These are the stated kinds of findings. And this findings of a consultant oftentimes need to be made particularly when you have a wellness program that's in place. You want to build a case for changing that wellness program and moving it to a more effective model. So these are the kinds of things that I ended up sharing as part of the findings to justify the shift to a more of a results-driven wellness model. One of the findings was employer wellness activity is currently very uneven and limited and uneven. So that was one of the findings. Participation is generally limited to employees, so you're not reaching many of the spouses. There's no system-wide health and productivity management effort in place at the current time. The current activity utilizes a traditional program model, and that's that smorgasbord kind of model, with uneven and limited system-wide interaction or integration. So we were essentially pointing out the limitations of their existing wellness effort. The overall potential of the use at will nature of the program has limited potential to improve the health of employees and spouses. They had a program in the traditional model that didn't have much of a compelling reason for that 80% of the employees that were not intrinsically motivated to do wellness to actually take part in any wellness activities. So that's what we were emphasizing. The return on investment for the current non-program is likely to be low and virtually impossible to accurately measure. So we were pointing out the inherent problem of those traditional wellness programs where you really lack a very effective way to look at the results of the program. A sound program infrastructure and integration with newer virtual types of health and productivity management activities is needed. So what we were saying is you need to have that infrastructure in place. It needs to integrate with newer virtual kinds of services. A shift to results-driven wellness is needed. Currently, no effort has been made to create a culture of wellness across the organization, and the organization's name can therefore derive multiple benefits from a concerted effort to build a strong enterprise-wide wellness program. So these findings of a consultant's analysis of their program is what then set the stage for the retreat setting and for taking the design of their wellness program to the next level. Now, needs and goals, as we think about the needs of a wellness program in this particular situation and almost any situation you will be looking at, there's significant health needs in our population. They run across a whole gamut of different health risk issues and health behavior issues. Workforce is highly entitled, so they feel like we should have benefits and not have to do anything, and all of this should be crafted for our own benefit. We must not alienate them, so we don't want to do things that are going to alienate them in any way. At the same time, we also need to increase participation and engagement. So that becomes kind of a need for the program design that you're coming up with. Also need a core system program, so something that goes across all, in this case, 24 different hospitals. And the health costs must be stabilized. So they were looking at fairly high rates of increase in healthcare costs each year, even though they were giving themselves a discount off of the use of services within their system. They were still experiencing fairly high pressure, economic pressure, financial pressure, management pressure from those health costs. They also needed to build on site initiatives. So they needed to do a program that didn't take away the initiative and the interest and the ownership sense of each of those individual hospitals. Now, the goals that they ended up with are to reduce health cost growth rate, that's the medical trend, to achieve a positive ROI for the program, to improve the integration of health services and their impact on the population, to increase the productivity of employees with measurable metrics, to create a healthy culture and a sense of a culture of wellness across the entire system, and to create a best-in-class kind of program, and finally, to become a national model. So these were the goals that this planning group that was done with 24 hospitals actually came up with, that they have worked on since the time that this was done. They've achieved most of these goals through their efforts in wellness. So the idea is we're looking at a series of needs that are articulated and then those goals that are prioritized across those areas. So this data came out of using that modified Delbecq or Delphi process to come up with a prioritized list of needs, goals, interventions. And we actually did the same thing with evaluation metrics as well. Now, some planning do's and don'ts that I've learned over the years. First of all, on the do's, do get a clear mandate first. So you have a clear idea of what the group is expected to come up with. And it's best to get that in writing. That should be clearly stated, and it should give you your marching orders. Secondly, do examine what's available. So what services are available in the various areas? You may do a survey, or you may do a survey process across the organization to find out exactly what's being done currently in wellness. You want to and do want to collect hard data. You want to do interviews. You want to use focus groups. You want to arrive at a set of conclusions, of findings in that process. And you want to reflect the employee role in the program's design. So if we're using, in this case, we used a survey device to collect feedback. We also took focus groups and used their feedback to help them present to employees the program after it had gone through this design process. So those are some of the do's that we want to kind of suggest to you are important for you to consider. The don'ts should include, don't fail to examine the history of wellness at that organization. So whatever situation you're dealing with, you have to ask the question, what's gone on before? How successful was it? What did people think about it? You don't want to draw too many conclusions from self-reported data. So any data where you're using a survey device and people are reporting and saying, we need this, or this is important for us, oftentimes that information is given from a perspective that says, I want to make sure my workmate gets this weight management program because he really needs some help. So I'm going to go ahead and say on the survey, of course I'll take part in the weight management program. And so be careful about drawing too many conclusions from self-reported data, particularly when you're asking people questions about the types of needs that exist in the population. Don't fail to get data sources. So whenever you have data, make very clear the source and where you got it, because it oftentimes shows up that you end up getting down to a certain point in the planning process and somebody says, I don't think that data is accurate. Where did you get that? And if you can't tell them where you got it, then that just weakens the momentum for a design process. Don't forget to provide survey feedback back to populations. I think one of the reasons why we have such low survey outcomes when we're looking at working populations is we frequently forget to provide any feedback to people that have completed a survey about what the results are. So if people know that they're gonna learn what they put on the survey and what others put on the survey, they want to see how their answers compared with other people's. So if we take that away from them, we actually reduce the sense of intrinsic value that they see in the survey, and not as many people fill it out next time. So don't forget to provide that survey feedback. And don't overlook key stakeholder opinions. So if there are some people that really have been around a while, they understand the situation, they understand the people and the organization and the workforce, you definitely don't want to overlook their opinion. And so that means that some of the people you may want to choose to do some separate interviews with, where you're bouncing information off of them and asking for more of the why type of question or answers to the why question. So that's something that is helpful for you in terms of planning do's and don'ts. Now, there's some overcoming some major challenges in this process. And first of all, one of the major challenges is sometimes we go too quickly and don't have a very clear sense of the mandate. So that major challenge is an unclear mandate. And that mandate is, what are they looking for? What do they want? If I come back with a 120-page proposal, are they going to say, well, we just thought you were going to go off and do a one-page, write-up on this? Your detail level is not, doesn't align with our expectations and the mandate that we gave you. That's why you want a mandate in writing. Little management support, so that's a major challenge. Another one of the challenges is employee apathy. So if you've been in a culture where people don't feel a sense that they're valued or respected or honored in any way, then they tend to be apathetic in dealing with any efforts that you might have to design a program. Another one of the challenges is a major cultural change and instability. So if the organization has gone through maybe a downturn in revenue that's related back to a market, something that's happening in the markets that you're in, can be a potential cultural change and instability source. Also, no survey data. So if we don't have any sense of what the population's interests or needs are or preferences, we don't have any HRA or health risk assessment or well-being assessment data. We don't have any claims data on them. That's a challenge for us. Also, remote work sites. So if those remote work sites are oftentimes seen as estranged from your central office headquarters group, that's going to be a challenge for you. And sometimes we have unrealistic start dates. Some managers like to pride themselves in being able to ask for unreasonable performance and forcing people to give that unreasonable performance. So if they're thinking of launching a wellness program and it's 2 months off, and they give you 2 months to get a wellness program together for 24,000 employees, that's an unrealistic start date. So that can oftentimes, again, be a challenge as well. And sometimes just having a large blue collar workforce or a workforce that is not easy to serve given where their location is. One of my clients one time was actually an offshore drilling platform. So those are hard situations to deliver wellness in. So that can sometimes be a challenge as well. And finally, sometimes we have influencers that we're not aware of. They may be friends of the CEO or friends of a CFO or golfing friends, or maybe people that they go on vacation with from college. And those influencers can bring various bias into the situation. So that's another one of those challenges to a planning process like the one that we're talking about in this module. Now, there are a number of integration opportunities. These are places where wellness can either receive or connect with. So these can be referral sources. They can also be sources that refer back the employee back to the wellness activities. They sometimes can be places where we put interventions of different kinds. So these are all different places where integration opportunities exist. And integration can be at the level of the wellness program itself. We call that level 1 integration. It can be between the wellness program interventions and other activities like the ones listed here. That's a level 2 integration. And level 3 integration is how well does our wellness program connect with external resources like the local hospital program or a weight management program or smoke enders or some other kind of activity in the community. So those integration opportunities are definitely there, and they definitely come about as part of a program design process. You're kind of asking people, what are the connections? And if you frequently want to be looking at the employee handbook to see where some connection points are that are potential connection points for the wellness program that you're involved in designing. Now, the key planning questions, and these are the questions which I've used over the years to help structure this kind of facilitated design process. And the key planning questions are these. We usually start out with what should be the strategy and timeline of the new program. So we want to kind of identify that issue. And part of that orientation that we give people in that first half day is to actually introduce them to the feel-good wellness program model, the traditional wellness program model, and the results-driven model. And then ask them, which of those strategies do you feel are appropriate for your organization and what you want to accomplish? And then the timeline issues are, how soon is this thing supposed to be on the streets, and providing services? Next question would be, what wellness needs should be addressed? And again, in the context of that modified Delphi technique, it's asking people to come up with ideas, to do the brainstorming list, and then to vote on the items that they feel are most important. And then what should be the goals of the new program given the needs that we've addressed? And usually goals are going to help you address a portion of the need that you've uncovered. Then you're going to ask what program activities or interventions should be offered. So that helps people then begin to make a connection with what my goals and what I need to be doing in order to accomplish things. And finally, what issues should be evaluated? So those are the main questions I'm going to ask in the planning process to help move this process along. Once I've asked those 5 questions, there are some other questions that are optional that I could potentially use with the group. And these include, what incentives should be used? How should the program be introduced? What is the approval process it needs to go through from this process forward? What are the next steps after approval? So these are going to be additional questions that could be asked of the group to help you as an outside consultant that's working on the design. It will come up with a proposal for the design to actually know what those next steps and what the process is that you need to complete. Now, the contents of a program proposal that I've used over the years are these. So if every one of the large proposals, 60 to 120 pages in length, would have an executive summary, and that would usually be 1 to 3 pages. So that's the executive summary, and that's oftentimes all you would use with a senior management or executive management team. Yet also then the proposal itself would have a preface which would give some of the background to the process and to the purposes of this. There would be an overview of current wellness program activity, and that would be a brief historical overview, some informal program review findings, and that's where I would insert the findings, the consultant findings on the existing program. Then a summary of major organizational needs related to wellness. So that would be an area where the kinds of things that need to be part of the vision for wellness need to be articulated. Then some specific needs that must be met in any wellness initiative. So that would set the bar for how this wellness initiative would be rolled out and how it would essentially meet the needs in that organization. Then a mission statement and values regarding wellness. So how that might be crafted to fit into the organization's larger mission statement and value statement. A proposed set of program goals and objectives. So we take the goals that would come out of the planning process and actually move them down into 5 to 8 objectives that were time limited, measurable, slight stretch objectives. Then proposed organizational infrastructure. So that would kind of basically say, here are the things we have to put in place in order to have this program be sustainable and to produce the results that we want. Budget projections, and we used essentially embedded Excel tables, which we cover in level 4 and provide you with actually templates for these so that you can develop your own budget projections and integrate them into a proposal like this. We also provide in level 4 an actual sample template that you can use as a starting point for actually putting these kinds of proposals together. And then projected economic yield. That would usually give a range of economic yield based on the literature. And then a proposed evaluation plan. So that was all of the activity that would be involved in the evaluation. And then a proposed next steps. And then one of the items that is not on here that should be is the last one, where usually exhibits. And exhibits would be parts of the process that you would go through to address issues that can come up in the planning that allow you to get ahead of those issues by taking a specific issue, for instance, like a potential incentive design, and having an exhibit that says proposed incentive design for wellness. And then that would have all of the detail in it. It would be similar to what you might find in some of the course workbooks, particularly for level 3 and 4, that have a lot of detail to the incentive design. So the exhibits would then have a variety of different things that were intended to meet objections, stakeholder concerns that come up through the process that would actually be part of your proposal at the end. It's kind of the detail that would allow a manager to know, okay, I was concerned about this, but I see they're proposing to address that. So these are the contents and the organization of the contents of the program proposal for one of these large-scale wellness program design projects. Now, here's a summary of key points for this particular module. Complex organizations usually need a facilitated planning process. Now, they can put a program together without having help, but that program is not likely to be either as effective or as efficient as something like we've proposed here. The process should be used to help develop a program proposal. So that's the output, that's a deliverable from the process of program development. You will need usually an inside and outside leader. So I always would find an inside leader that I would be interacting with. I would be the outside leader that would kind of come in and help facilitate and lead the group, but also provide them education and also provide them with advice as the process unfolded. You want to lay out the process. Usually I found a 2-day planning retreat, then a follow-up, 3 to maybe 8 weeks later of a 1-day with all of the same people to take the draft proposal, which I would send them to review ahead of time, to a final proposal, and then to come back at another time with, once the proposal was finalized, with a PowerPoint where the leadership from the design team and I would then present that to senior management. And that's how we would progress and move through the program development process. We usually want to educate, then move into a planning process. You don't want to just start the planning process without some time for people to digest what it is that wellness is about. You want to use key planning questions to focus the activity. You want to try to resolve all major differences. So if there are some things that need to be handled offline, you then essentially can do that between the time periods of those 2, 1, and 1-day presentations. You want to use a nominal group process, a modified Delphi technique for a quicker consensus process. You want to keep the proposal draft until the group is happy with it. So you don't make it something, you don't make it final until everybody's essentially looked at it and said, yep, this reflects a good approach for our organization. Get everybody's fingerprints on it. So we would always have at the beginning of those proposals a listing of all the people that were involved in it. So that becomes their fingerprints. They then cannot say, well, I didn't know about it, because they're identified in it and the report comes from them as the planning and design team. And the proposal really is a blueprint. We call these blueprints for wellness. So the idea of having a blueprint that the organization gets that can help them actually implement a more state-of-the-art design for wellness across the large organization is what the intention of this kind of product and service was. But just remember, it's not over until it's over. So there are always things that can come up in the process. You just have to be flexible in dealing with them, but you learn kind of how to suss those out over time as you gain some experience with this kind of process. Now, let's cover some key questions. Our first question is, why is it valuable to perform a formal planning process for a wellness program? And I found this process to be very important because it allows me to get a much better design from and with greater involvement of the people who have to carry it out. So that's a first and foremost kind of value. Secondly, it increases the sense of ownership that the individuals that you're working with have for the wellness effort, because they really are shaping it. Their vote is counting the same as everybody else. It democratizes the effort, it equalizes the effort, it broadens the effort's involvement and engagement. And it enhances cooperation in terms of actually carrying through on what the program is supposed to do. Everybody's kind of identified, and what their role is identified as being able to help with is usually identified in a proposal like this. And then fourth, it provides a detailed blueprint. So I have something to go from in terms of moving forward, and that allows me to usually do a faster implementation of the program. It's a quicker startup. And finally, to improve the results of the wellness effort. So that's what the value that I found and people would in fact deal with when I was doing this. I would generally charge somewhere in the area, in today's dollars, somewhere around $50 to about $80,000. So that's what the process, what I charge for the process in today's dollars. Now, question number two is, what are the major challenges to the planning process? And I think the major challenges that I ran into over the years was, first of all, keeping the organization and the people focused. So there was always a tendency that they would get off focus or get something, sometimes shiny object syndrome would take place, and they would get fixated on a particular thing that was not really largely important in the broader scheme of things. Another one of the challenges that I've encountered was their follow-through, their ability to follow through on a plan or on a blueprint. The third thing was handling competing and counter positions on the part of people within the planning process. So that handling competing and countering positions was one of the challenges. And then finally, overcoming some of the natural competition that people feel inside large organizations. They're worried about a zero-sum game, and they're worried about losing their position if they see more resources, for instance, going into wellness. So those are the things which I found to be the major challenges for a planning process like this. The third question is, what are the main deliverables from this kind of planning process? First of all, one of the deliverables was really an information and education session deliverable. So that actually helped the people get up to speed with their vision for what could be a wellness program for their own organization. Secondly, there was an involvement roster, and that deliverable was the involvement of various people in the planning process. And I would make sure that everybody whose name was down on that proposal got a copy of the proposal, and I made sure that they agreed with the final version. So that involvement roster actually extended the sense of ownership and responsibility and accountability. The third deliverable was really the program proposal, and that would be that 60 to 120 page document that covered all the details, dotted all the I's and T's on a complex process like this. The fourth deliverable was a PowerPoint deck that was used for educational purposes and for presentation and approval purposes, but that PowerPoint deck became a briefing document for individuals that wanted to brief other groups on the wellness program. And then finally, I usually got toward the end of this process being able to give them an RFP set of specifications so that they could essentially go out and get a vendor to actually put together a lot of the different interventions which were part of the output from this kind of planning process. So those are the 5 deliverables from the planning process that most organizations found very high value in attaining and using. Now that you completed this particular module, go ahead and take the quiz.